Our fundamental thinking has to be informed by people outside the health sector, and I think one of the biggest issues in health is that we are very introspective and we don't look at technology, ideas and thinking that other people bring to the table. And just to give you an example, there's a really interesting competition which was run, which was basically asking people to identify a stream of cancers from images. And the person who was most successful in doing that was a banker in New York who took over his banking system for the weekend and wrote algorithms to deliver the answers in terms of was there a cancer, yes or no, and his success rate was about 90% in comparison to clinicians who were getting about a 70% success rate. 1 weekend of his time. And so we're foolish not to look at the experience of those people and say, how do we leverage that into our environment? And I think particularly where technology will play a place is as we move forward into research and understanding the implications of what will be called precision medicine, which is really personalised to me, and identifying what will work for me as opposed to Martin, is actually quite an important question, because if one drug kills me and keeps Martin alive, we kind of both probably like to get the right one. And we'll learn that from the technology world. And so absolutely we have to embrace those people, learn from them, and actually get excited about what they're doing. And the really interesting thing about Amazon came into being by using other people's infrastructure and assets. And I think in the Catholic health world, we need to learn from that, because we can actually learn to use the assets that other people have in the community already. We can use the infrastructure other people have, but actually produce what we do brilliantly, which is medicine to people where they are without having to look at rebuilding new hospitals. We need to think differently, and that'll be, I think, in the future in people's homes, and how we get into that space is going to be an important part of the future for us.
And just while I'm with you very briefly, if you could, Toby, it does segue nicely into a question I had for you about the need for collaboration and partnerships. And how the Catholic health and aged care sector might look in 2038. Certainly we heard Paul Robertson say in his opening speech that we need more of that kind of collaborative partnership, and perhaps outside the usual paradigms of the healthcare system. How do you respond?
First, it would be very rash of me to not agree with Paul. Look, I take this back to really, what are we as Catholic health? The founders of our organisations, who we all revere and look up to and sometimes maybe idolise, didn't establish the work they established for us or for congregations, or, to be fair, for PJPs. Now, I don't want to offend anyone in saying that. They did it to, in their words, extend the healing ministry of Jesus. And so as we look to the future, I think the first thing we have to do is go back to principle one, which is to say, are we looking at a system which is extending the healing ministry of Jesus? And if we're not, and we don't create a system which is differentiated from everyone else, then frankly, we're wasting our time, because that's not what we were set up to do. So the first thing is we have to get some grounded principles, and to an extent, I think one of the challenges for us all will be to put ourselves, our congregations, and our individual dreams aside to actually say, what should we be doing corporately as a Catholic healthcare sector? Mary Aikenhead, who's our founder, had this wonderful quote, which is, just because it hasn't been done before doesn't mean it can't be done now. And if you step back and look and said, what could the Catholic healthcare world be in the future? We should be the preeminent provider of care in Australia. When you combine the turnovers of the people at this table's organisations, we are the largest provider of health outside government. In fact, we come close to rivaling Ramsay's and Healthscope. And yet we don't have a Catholic brand that's saying, this is the Catholic Church, this is its ministry, and it is making a difference to our community, the most disadvantaged. We've got isolated individual brands which, when we're separated, don't actually show the collective good of the church. And I think that's something we can respond to firstly. The second thing is then actually looking at the reality of the future of health. If you go to look at the American market now, and I know we don't like to look at America, But what has happened in the American market is coming to Australia, and if we don't think that we're going to have the same cost problems they've had in America, we are daydreaming. We've got our heads in the sand. And it was desperately sad to go and see some of the congregations whose names are gone, whose organisations are gone, who've been swallowed up into a behemoth called Ascension Health because they had no other choice, because they didn't determine their future. So I think for us as a sector, we have to determine together what is the future of Catholic health in Australia. And what a wonderful thing it would be if we acted like the biggest provider in Australia and said, we are going to be organisations that care for the people in our communities. Where are the Catholic providers in the most disadvantaged communities in Australia actually serving the poor as opposed to serving the rich? Where are we working together to say, we all know that hospital in the home is going to be the future. There's no point in St John of God, St Vincent's, Mercy, Calvary, Cabrini, all setting up their individual hospital in the home systems with CEOs, accountants, computer systems behind them. So we've actually got to learn to say, how do we work together to do that jointly? And wouldn't it be brilliant if we were the largest provider of in-home services, genuinely caring for the Catholic and wider community and showing the healing ministry of Jesus? In our aged care environment, we're, again, a significant provider of aged care. But most people wouldn't know that because we're fragmented, our names are fragmented, our brands are fragmented. Aged care is becoming more and more complex. And we're being stupid because we should be a provider that can do things differently. And yet we've been sucked into the government telling us this is how you have to do aged care, and stupid regulations that say an old person can't go and grab a beer out of the fridge. They can't cook a barbecue in their aged care facility. For goodness sake, they can't even cook a cake. And we're stupid enough because we fragment ourselves to not challenge that direction and regulation. Whereas if you're big enough and strong enough and you bring the brand together, we've actually got a position in a place of power to say to government, actually, the model you're putting in for aged care is not aged care at all. What it is aged institutions. And as a Catholic sector, we should be saying it is about aged care, and care is about us showing the healing ministry of Jesus. Now, if we use our power together, we can do that. There's then a whole range of technical issues in terms of the technology, which Shane has talked about very articulately. If you look at the issue of just getting clinical information systems into our hospitals, across this table, I'll do a rough estimate, but I would expect the cost would be $1.5 billion or so to put computer systems into our hospitals, which is a huge amount of money. And if we don't work together on that, we actually, I think, will not be able to afford to do that as a sector. I was talking to, and the saddest thing, I was talking to one of our colleagues, it doesn't matter which hospital they're in, but they're an isolated regional hospital this week, being picked apart financially by Medibank and Bupa because they're on their own and they're easy to pick apart. And we're sitting there and letting that happen because we haven't used the strength of our brand to support them. The same is happening with procurement. Our aged care organisations and our hospitals are buying products independently and not getting the economies of scale that we could have. And I'm not saying big is best, but every dollar that we waste in bad procurement, bad systems, bad and over-managed organisations is actually money stolen from the people we're supposed to give ministry to. And how powerful could it be if we actually took that money and went into the highly disadvantaged communities and said, at last, someone's going to give you the healthcare you deserve? Because at the heart of who we are, we talk about serve the rich to benefit the poor and give them the same service. The reality is we're not delivering on that promise. And I think for the future in 2038, I would hope that people look at us and see that we're genuinely serving the marginalised, genuinely serving the disadvantaged, because we put ourselves aside, made our sector efficient, leveraged our brand to actually make a difference. And if we can do that, I think it will be a wonderful future for us. I think the first thing is that the charism of the sisters is actually the charism of the church. And it's easy to get lost in the, we're here to replicate and do what the sisters did. And frankly, I'm probably not going to do that because I'm a male. So we then have to step into saying, what was the heart of the sisters? And the heart was to deliver the mission, which is the healing ministry of Jesus. And if we want to differentiate ourselves, firstly, I absolutely believe in excellence in everything we do because it's a differentiation and it shows we care. For our people, we need to teach them the radical concept of loving one another. It's not rocket science, it's a very simple process of saying we differentiate because we love. The sisters were known because they loved both in the hospital and the community. That's what differentiates them, is they're showing the love of Jesus to people. And we need to say to our people, we're actually here to be care organisations. Frankly, there's a ton of people who can deliver health. There's a ton of people who can deliver aged institutions. But actually helping our people understand care is what the charism was about. And our heart has to be to come back to care. Our doctors are competent, they're courteous, but actually often people in most of our hospitals are not finding they're cared for. And I think we have to reinstitute care. I think what Linda said about what they're doing, that's care. It is different. It's just showing that we are showing love to people, and that's the heart of what we have to do. And we have to help our people understand that. Now, they may not get the whole religious side of being Catholic. They may not even be Catholic themselves, but they can live the charism for the future. They can be the charism of the sisters by loving others, and that's what we're trying to institute at St Vincent's. And I think we have to build on that differentiation and help our people understand it. And our country, regardless of what people say, is a spiritual nation. We don't like saying it, but we are spiritual people. We want the spirit, and in fact, people are crying out for it. And they come to our hospitals often, particularly our staff, because they know there is something different about us and they want that difference, and that we've got to build on and take into the future.